Hi friends, I'm Dr. Swapna Chekuri from Hyderabad Women and Fertility Center. Welcome to my channel. So today let us discuss about intake of paracetamol in pregnancy. So usually in pregnancy, these headaches, body aches, backache and even leg cramps, these are all quite common complaints in pregnancy. But basically we need to rule out underlying causes of all these aches. See, for headache, usually you need to rule out any cold or any change in the eyesight, or does the lady is having already pre-existing migraine in pregnancy that can get aggravated. So these are all the common causes of headaches in pregnancy. And inadequate sleep, at least 6 to 8 hours of sleep is mandatory during pregnancy. So if at all underlying factors, suppose these pre-existing factors are there, then we need to advise them to take steam inhalation, which can relieve most of the headaches. If at all any migraine headache is there, they need to consult a neurophysician. And if at all any pre-existing conditions are there, then we need to address it accordingly. So in spite of all these precautions, still if they are having severe headache and all, they can take paracetamol, which is quite safe during pregnancy, because that's the only painkiller we advise. And the rest of the painkillers, there are so many other painkillers, but we don't advise because they belong to category C and D, which can affect the health of the baby and it can affect the bone growth of the baby as well. That's why in pregnancy, paracetamol is the only safest painkiller which they can take. And that too, when all the home remedies have been tried out, still not getting relief, then they can take paracetamol occasionally. Same thing with the backache as well. See, backache is again because the pubic joint, it becomes little laxity during pregnancy. So that could be reason for backache. And calcium and vitamin D deficiency can lead to backache. So if at all, if there is any deficiency, if we can replace that, then obviously the backache will come down. And simultaneously, we need to rule out urinary infection and constipation as well. If at all any urinary infection is there, we give a course of antibiotic and that can relieve the pricky pain. And then in case of constipation, we give laxatives and we ask them to take high fiber diet, plenty of fluids, which can relieve constipation, and that's how we can reduce the backache as well. So these are all, the underlying causes needs to be addressed first. In spite of all these things, still if at all if they're having pains, then they can take simple paracetamol. And it is quite safe and there is no effect on the mother and the baby as well when taken in a limited amount. So that also you should not take 4 to 6 tablets per day. It's not advisable, hardly 1 or 2 tablets you can take, that too for a temporary relief. Okay, so friends, if you find the video is informative, please like my video and share with your friends and needy people. Thank you.